I would be talking about apical impulse. So first I would be talking about definition. It is the lowermost and outermost point of definite cardiac impulse, means electrical excitation, electrical stimulation of the heart is felt at the lowermost and outermost point with a maximum perpendicular thrust, with a maximum perpendicular force to the palpating finger. It is produced by the left ventricle and left ventricular portion of the interventricular septum. So normally it lies 1 centimeter medially to the mid clavicular line or 10 centimeter lateral to the mid sternal line in the left fifth intercostal space. So this is the definition. Now I would be talking about abnormalities. So it is absent apical impulse. When it lies behind the rib or behind the sternum, then you would not be able to feel it. And also in dextrocardia, heart is on the opposite side. Tapping apical impulse, it is seen in mitral stenosis, and in mitral stenosis there is palpable S1, the first heart sound is palpable, and you can feel a tapping apical impulse. And now I would be talking about hypodynamic and hyperdynamic. Hypodynamic, from the name you can see there is decrease in the amplitude of the apical impulse, and it is seen in these are the conditions: obesity, acute MI, pleural effusion, constrictive pericarditis, and COPD. So these are the conditions where you will get hypodynamic apical impulse where the amplitude is decreased. Now I would be talking about two more important aspects: hyperdynamic and heaving. In hyperdynamic, there is increase in the amplitude without an increase in duration. The duration is normal and amplitude increases. So basically this is hyperdynamic apical impulse. And in heaving there is increase in both amplitude as well as duration. Now diffuse apical impulse means it is not continuous, it is diffuse. You can feel it diffusely. So it is seen in left ventricular aneurysm, means abnormal dilation of the blood vessels. So left ventricular dilatation and aneurysm, and left ventricular dysfunction. So in these conditions you will see diffused apical impulse. Now double apical impulse, it is seen in hypertrophic obstructive cardiomyopathy, left ventricular aneurysm, aortic stenosis with AR, and left bundle branch block. So these are the conditions where you will get double apical impulse. Triple or quadruple apical impulse you will see in HOCM. And retractile means the impulse, it goes inside, it goes inward. So it is seen in constrictive pericarditis and severe tricuspid regurgitation. Now I would be talking about difference between heaving and hyperdynamic apical impulse. So time, duration, it is increased in heaving and it is normal in hyperdynamic, as I have discussed. Amplitude, it is increased in both. Duration, heaving, it is greater than 2/3 of the systole, and hyperdynamic, it is greater than 1/3 to less than 2/3 of the systole. Location, heaving, it occupies one intercostal space, and hyperdynamic, it occupies more than one intercostal space. And causes, so this is very important causes. So heaving, it is caused by left ventricular pressure overload when there is stenosis, when there is obstruction. So there is build-up of pressure and you will see a heaving apical impulse. So you will see in hypertension, coarctation of aorta. So this is heaving. Hyperdynamic causes when there is left ventricular volume overload, and this is basically seen in regurgitation. So because of the regurg, there is dilation of the heart chamber. So it is seen in aortic regurgitation, mitral regurgitation, VSD, ventricular septal defect, PDA, patent ductus arteriosus, and high output states like anemia and thyrotoxicosis. So basically this is hyperdynamic apical impulse. So this is differences between heaving and hyperdynamic apical impulse. Thank you.